name is Donald Brooks, and I am founder and CEO of ISNTD Water, as well as I'm a researcher at Harvard University in the Center for Systems Biology. And today I want to talk a little bit about kind of how ISNTD Water engages in the water quality and water quality surveillance aspect of urban WASH and WASH planning, specifically in developing urban centers. And so just a little bit about who we are as an organization to kick us off. We are an international NGO focused on providing sustainable support to regions experiencing lack of access to clean water and to basic sanitation. And we do this through our approach, which we define as human-centered and human-designed, but data-driven. And so our focus is, our programs are split between kind of the urban and the rural arena, and we have designed them to meet the specific characteristics of each arena. And of course, as most of us share in this room, our vision is a world where everyone has access to safe water and sanitation. We work currently in 2 countries. Our focus is West Africa, and so we work both in Burkina and Nigeria. And today I want to focus on the work that we do in Burkina Faso, which is where we're piloting one of our programs developed specifically to deal with urban WASH. And so just to kind of situate where I want to go in terms of talking about our program, just a few statistics that are relevant in the context of Burkina Faso.
So approximately 25% of water points across the nation are deemed non-functional through studies that have been conducted by the Rural Water Supply Network and other bodies. As well, organizations and institutions in Burkina have estimated that all children experience over 6.8 cases of severe diarrhea during childhood attributable to unsafe water. And so these are obviously significant problems that continue to plague the development space, and this is something that has inspired and promoted the design of our program and our work. And so then just considering the infrastructure as well, and so this is again more kind of situational information. Of course, due to limited resources, a lot of infrastructure investment in developing urban centers is not optimal, in that it's only often city center regions in the largest cities in these developing nations that are devoted and allocated the proper resources to develop and maintain complex water infrastructure systems. And so kind of in this lack of resources, there's a large heterogeneity in water infrastructure that we observe even in the largest of cities. And so in the context of Burkina, looking at Ouagadougou, the capital, with a population of approximately 3 million individuals, water infrastructure is quite robust for the nation, but just outside of this water network, we start to see kind of a mix of different water infrastructure. So we see kind of installations that are maintained and operated by the public water utility, ONEA, in the nation of Burkina, but you also start to see boreholes, open wells, and other water sources and water points that are maintained by NGOs, community groups, and a range of other institutions. And so kind of in this heterogeneity, we start to see also heterogeneity in the evaluation and monitoring not only of the functionality of these water points, but also in the water quality that's of the water that's being conveyed. And so this is a map of Fada Ngorma, which is a city of approximately 45,000 individuals in the eastern region of Burkina Faso. And so what we start to see, given the intense focus of development aid towards water infrastructure in the major cities, so Ouagadougou, again with a population of 3 million, a lot of these smaller, more satellite periphery cities are not afforded the same capacity in terms of funding to develop these systems. And so in these areas, you can see here, this is the central business district of the city, and so houses and businesses in this area of the city will have piped water into their homes. But once you get outside into sectors 9, 7, and 8, you start to see again this heterogeneity come to play where people still walk to go get water from sources that are of differing origin. And so just a couple of challenges as well before we get to the program that we are working to implement. It's currently not known exactly the proportion of individuals who are collecting water from these government sources and then from these non-government NGO type maintained sources as well. Nor has there been a standardized comprehensive study of water quality across a developing urban center like Fata Ngorma that has this high mix, highly heterogeneous kind of situation of water infrastructure. And so this is where, and kind of in the context that we've developed WASHMobile, and WASHMobile is a method by which to collect and disseminate water quality information using mobile phones and a robust yet highly cost-effective monitoring test kit to reduce and address waterborne disease and specifically diarrheal diseases. And so WASHMobile overall is a pipeline because it brings together several pieces of innovative technology, and it can be broken down into 3 different components. The first being water analysis. And so in order to make use of water quality information, it's necessary to actually complete these tests. And so the tests that we use are a combination of 2 indicators for bacterial contamination, as well as turbidity, which is something we use to just measure overall physical contamination in the water. This information then into the next component is collected and submitted via either offline form or via SMS as opposed to an app. It's then weighted accordingly. So of course, E. coli, which is one of the indicators we test for, will be weighted more heavily than a high turbidity score. And so from this differential weighting, we produce a single water quality grade that's then assigned to the water point and used as a comparison across the water points in a specific geographic area. This information, and then in the third component, is information dissemination and making sure that the information we're collecting is actually used and is able to affect change. And so in considering kind of how we want to use this information, there are 2 different groups of people that we target, groups and institutions rather. The first being actually individuals. And so a bit more context. In a specific area like Fata Ngorma, outside of where is serviced by water infrastructure, we see again a relatively dense spread of independent water points. And so if you take, for example, someone living within this radius here, there are several water points from which they could choose to collect the water that their families and themselves need for daily activities. And so really, we're looking to see if this information, if we provide them this information, would they use it so as to choose the source that is of highest quality and therefore the least likely to cause waterborne illness. And so this information is disseminated through 2 methodologies, both an online interface, which is, of course, only usable by individuals with access to the internet. And the second is by an SMS subscription and response service. So individuals could either text in, oh, I'm in this area, there are 4 sources near me, which one is the cleanest? Or they could text in a specific well ID number and get back the information that way. And we've opted for an SMS-based service as opposed to an app, given that we want to target the bottom billion. And so many of these people will not have access to a smartphone because it is a price point that many people can simply not afford in the areas where we're working. So again, we work with individuals, but then the second kind of demographic that we're looking and we target with this information are institutions, both governmental, NGO, and multilateral. And so with this information, we are able to generate a robust landscape view of water quality across a city, which is then, of course, useful for targeting infrastructure development and highlighting the areas in which the city needs the most support in terms of future state-led infrastructure installment. As well, it is useful and can be used by public health bodies like in Burkina, the National Public Health Laboratory, to target the specific areas and identify the specific times during the year when these areas need to be sensibilized in terms of hand washing or water treatment so that we can make sure that in these times and in these places, we're most effectively using available resources to reduce waterborne illness across the city. And so that overall is what we do in terms of the urban arena. Initiative O also works in more traditional development, kind of rural applications where we work with communities to install either boreholes or other water points, as well as sanitation and hygiene education. But for the context of this talk, I wanted to focus specifically on what we do in the urban arena. And that's it. Thank you.